Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Ayim, triple board certified cosmetic surgeon and OBGYN. Let's get polished. So you have absolutely spent so much money to invest in cosmetic surgery, and afterwards you expect your results to be smashing and out of this world, right? Well, what if I'm here to tell you that that is not the correct perspective? The right perspective is to see cosmetic surgery as your starting point, not the finish line. Welcome to this episode, and you know, it's my jam. I'm a cosmetic surgeon. I've performed thousands of procedures, so I can kindly tell you what my observations are regarding patient post-op results and what helps them sustain the results and have amazing outcome. Integral into it is exercise. What I have seen in my practice is that if a patient has a good exercise program, integral into her cosmetic surgery transformation journey, the results is spectacular. But let's rewind a little bit, okay? On this episode, I'm going to cover a couple of things. I'm going to talk to you briefly why or how exercise supports your healing, how it enhances and maintains your results for you, and when to return to activity after surgery. And lastly, the mind-body connection, post-op as a unit. Both of them need each other. Your mindset, moving your body, and your results. It's like a triangle, 1, 2, 3, okay? Now, let's talk about how exercise supports your healing. It goes without saying that when you exercise, you're improving circulation. Your surgery, whether it's an incision cut from a tummy tuck, mummy makeover, or just a body contouring, we want blood flow to go to that tissue so it can heal. So your circulation is very important, and movement, exercise after your procedure is integral in helping you recover. It decreases swelling. It helps reduce inflammation. It helps the tissue recover faster. So that's the first thing. The second thing is just lymphatic flow. Gentle movement helps with fluid movement. It decreases fluid retention, something that we call seroma. You've probably heard of this word or not. And so it helps decrease fluid collection and accumulation. So that movement and the lymphatic flow is fantastic. And you know, if you are a patient in my practice, I also recommend lymphatic massages that goes after body contour and procedure, even facial procedure, because I want that lymphatic system to flow and give you some amazing results. So those two go hand in hand. The third thing is reduce complications. The reason why movement is important for you post-surgical surgical results or surgical contouring is that complication rates are lower. And they're lower because healing is faster. So that is really good. Early movement is something I recommend to all my patients. If I've done your procedure, let's say I do body contouring and there's no cutting, I tell my patients literally by day 3, I need you up moving to the best of your ability. Day 1, you are moving very lightly, nothing too strenuous, but by day 3, I need you back at it. That is if you've had some body contouring without any cutting. If you've had cutting, like, a mummy makeover, tummy tuck, that is, I would prefer that strenuous or returning to full load is more of that 6 weeks, not sooner. Okay. So let's talk about muscle tone and structural support. When you have cosmetic procedure like body contouring, essentially all I've done is remove the fat. The fat is removed and the skin, which is a drapery, drapes on muscle. Now you have to activate that muscle after your cosmetic surgery procedure because that muscle activation is critical in how your results look. So if you want your results to look amazing, phenomenal, you gotta activate that muscle. And the only way to do it, obviously, is to exercise. You have to be intentional about doing exercising to sculpt and build that muscle so that the skin drapes looks different. Remember, prior to surgery, there's fat layer there. So if you do like a liposuction body contouring procedure, that fat is significantly reduced, or I would say reduced. All of it is not out because you don't want to do that as a surgeon, but it's reduced. So now you have this, empty space and the skin drips over it. So it may give you good results, but if you want to have that smashing results, you really got to activate the muscle underneath it. Okay. So that's something that I really tell my patients to keep that in mind. If you have like a BBL, for example, we can transport all the fat into your buttocks. That's great and all, but that's not going to sustain you. You want to do your squats. You want to activate that gluteus muscle because that's what's going to help build and sculpt the BBL so that the results last longer for you. Immediately after surgery, you're going to look great with or without exercise, but the key is to do that exercise, all right? The body works in a synergistic way. The mind, the movement, the results. I want you to keep that triangle in mind all the time. So muscle tone enhances the surgical artistry, which is what I have done for you. Now together, we're a team. I do my part, you put in the work, and we get this great results. You can, show it off and make sure you tag me as your surgeon in that journey. And I can celebrate you that you are looking and sustaining the work that I did for you. So we want to really activate that muscles for better health, metabolic health to be specific. And also remember, you're protecting your investment. You've spent so much money in your cosmetic surgery procedure. You want to protect that investment. It's like insurance, you want to protect it. So it's very important to keep the movement in mind. Now, as I mentioned earlier, gentle walking after procedure is what I recommend. And I want you to start the same day, regardless of any surgical procedure that I perform. That gentle movement is important for you. It helps reduce swelling, bruising, discomfort, and overall your lymphatic drainage is improved, and it helps complement you. So keep post-op massages in mind with it as well. Now, let's talk about hormones, aging, and longevity. We know that depending on your age, the cosmetic procedure can have a very drastic outcome. When you have, let's say, liposuction in your 20s as opposed to liposuction in your 70s, you're going to look different. You cannot expect the same results because you're not the same age and hormone is not the same. So, but some general things to keep in mind is that exercise boosts endorphins. And I really emphasize that for my patients because when I do the cosmetic procedure, you look great. But to feel great, you got to exercise because you got to release those endorphins. And that endorphin is going to be a natural high for you. And obviously, sculpting your body in the gym or at home, wherever it takes, will also be a natural high. And so you're going to feel great. There's nothing more pleasing to me when I see a patient comes back a year later and she looks way better than she did, say, 3 months, because I can see the results of her hard work with exercise. And she or he can also see that. So, the proof is in the pudding, like we said. If you put in the work, it's going to show. And a year later, you're going to be on a different plate compared to someone that did not put in the work. Now, recovery time, as I mentioned, the first couple of weeks is light if you've had a tummy tuck. If you've had liposuction, it's really a few days. But generally about 6 to 8 weeks, that's when you can go back to your full activity if you've had any kind of skin excision like a tummy tuck, okay? And the main thing is just when you return, still be mindful and connected to your body because not everyone recovers the same. There are some patients that have a faster recovery than others, but just gradually ease yourself into exercising your full activity. Now, I really want to emphasize this, okay? Your surgical shape has a lot to do with what is done post-op. Immediately after the surgery is done, you will see your natural silhouette contour that has been enhanced. But that surgical shape that you're really looking for is you and your effort that will give you that outcome. So it goes back to the same messages that I always have from this podcast, which is consistency, consistency. That is going to be your key to longevity for your results. And also just movement alone helps you maintain and elevate yourself. Now, I really want to encourage my listeners on exercise and cosmetic surgery. Those two go hand in hand. If you're a follower of mine, you see me on Instagram, especially my stories, I often post myself working out in the gym, just to encourage anyone that sees that. Sometimes I wake up at 5 a.m. to work out. Sometimes I am working out late in the afternoon, well, late after work. But the whole idea is that you find time to exercise because it's something that you prioritize for yourself. So you find time to exercise because it's something that you prioritize, and the best time is what fits your schedule. No two are alike. And I cannot stress that enough to you. You decide to work out, which is great, and you decide to have surgery, which is great. Together, phenomenal. I hope you find this episode helpful. And if you are one patient of mine and you get this amazing results because you put in the work, not because of what I did, I need for you to tag me. I hope you enjoyed this episode and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polish Beauty Podcast or at Dr. Daisy Ayim. Remember, new episode drop every Wednesday, so stay tuned. Please like, share, follow.